Medication abortion, sometimes called the abortion pill, is a method of ending a pregnancy using prescription medications. It typically involves taking two different medications. The first medication is called mifepristone, and then it's followed by another medication called misoprostol. This method of abortion is different from surgical abortion procedures because it doesn't require any invasive techniques. Instead, you take pills that cause the pregnancy to end and your body to expel the contents of the uterus. This method is typically used for pregnancies that are less than 10 weeks along, although it can sometimes be used up to 11 weeks, depending on the guidelines in your area. When used as directed, medication abortion is highly effective. Studies show it works about 94 to 98% of the time for pregnancies up to 10 weeks. How does it work? Medication abortion usually involves taking two different drugs. Number 1. Mifepristone, or the first pill. Mifepristone is taken first, either in a clinic or at home, depending on your doctor's instructions. This medication blocks the hormone progesterone, which is necessary to sustain a pregnancy. Without progesterone, the uterine lining starts to break down, stopping the development of the pregnancy. Number 2. Misoprostol, the second pill. 24 to 48 hours later, misoprostol is taken either by placing the pills between your cheek and gum or inserting them into the vagina. Misoprostol causes the uterus to contract and expel the pregnancy tissue, similar to how the body naturally expels tissue during a miscarriage. How medication abortion is done. Let's break down what you can expect during medication abortion. Number 1. Initial consultation. Before starting the process, you'll have a consultation with a healthcare provider who will confirm how far along the pregnancy is. They might use an ultrasound to determine gestational age and ensure that medication abortion is the right option for you. Number 2. Taking mifepristone. If you decide to proceed, you'll take the first pill, mifepristone, usually at the clinic. After swallowing the pill, you probably won't feel any immediate effects, although some people experience light spotting. Number 3. Taking misoprostol. 24 to 48 hours after taking mifepristone, you'll take the second medication, misoprostol. This pill is placed either in the cheek or vagina, depending on the instructions given by your healthcare provider. After taking misoprostol, you'll likely start to experience cramping and bleeding within a few hours. Number 4. The abortion process. Within a few hours of taking misoprostol, you'll likely start experiencing cramping and bleeding. This is your body expelling the pregnancy tissue. It's normal to pass clots, and the bleeding can be heavier than a normal period. Most of the tissue is expelled within 4 to 6 hours, although lighter bleeding may continue for up to 2 weeks. The heaviest bleeding and cramping usually lasts for a few hours, but you might have lighter bleeding for a week or 2. Number 5. Follow-up. A follow-up appointment is usually scheduled 1 to 2 weeks later to confirm that the abortion was successful. This may include an ultrasound or a blood test to check your hormone levels. What does it feel like and what to expect? Medication abortion feels similar to a heavy period or miscarriage. The most noticeable symptoms are cramping and bleeding. The cramping can range from mild to intense, depending on the individual, and is usually strongest during the first few hours after taking misoprostol. Many people describe it as intense menstrual cramps, but some find it more severe, especially if they are further along in the pregnancy. Along with cramping, you will experience heavy bleeding, which is a sign that the abortion is working. You may pass large clots, and the bleeding can be heavier than a normal period for several hours. After the heaviest bleeding subsides, you'll continue to have lighter bleeding or spotting for a week or 2. Other symptoms you may experience during the process include nausea, vomiting, diarrhea, dizziness, or fatigue. These symptoms are temporary and usually go away as the process completes. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Reasons for choosing medication abortion. There are several reasons why someone might choose medication abortion over other methods. One of the main reasons is that it offers a private and less invasive option for ending a pregnancy. Instead of undergoing a surgical procedure, you can take the medication at home, in a space where you feel comfortable. For those who may have concerns about surgery or anesthesia, medication abortion is an attractive option because it doesn't require those interventions. It also feels more natural, similar to having a miscarriage, and can be done earlier in the pregnancy. Risks and complications of medication abortion. Like any medical procedure, medication abortion comes with some risks, but serious complications are rare. The most common side effects include cramping, bleeding, nausea, and mild gastrointestinal discomfort. These symptoms are part of the normal process and usually subside after the abortion is complete. However, there are some potential risks and complications to be aware of. Number 1. Incomplete abortion. In a small percentage of cases, the abortion may not be fully complete, meaning some pregnancy tissue remains in the uterus. If this happens, a second dose of misoprostol or a surgical procedure, like vacuum aspiration, may be needed to complete the abortion. Number 2. Infection. Although rare, it's possible to develop an infection after a medication abortion. Symptoms of infection include fever, chills, severe abdominal pain, and foul-smelling discharge. If you experience any of these symptoms, it's important to seek medical attention right away. Number 3. Excessive bleeding. While heavy bleeding is normal, excessive bleeding, soaking through 2 or more pads an hour for several hours, may indicate a problem and should be addressed by a healthcare provider. Number 4. Allergic reactions. In rare cases, women may have an allergic reaction to the medication. If you notice signs of an allergic reaction like rash, itching, swelling, or difficulty breathing, seek immediate medical help. Most women who undergo medication abortion do so without any serious complications, and it's considered a very safe method of ending an early pregnancy. Who shouldn't have a medication abortion? Most women who are in the early stages of pregnancy can use this method. However, it's not suitable for everyone. You might not be able to use medication abortion if you are too far along in your pregnancy, have certain medical conditions like bleeding disorders or severe anemia, take blood thinners or certain steroid medications, have an IUD in place, it would need to be removed first, or have an ectopic pregnancy, a pregnancy outside the uterus. What about afterwards? After a medication abortion, you can expect some bleeding and cramping for a few days to weeks. It's normal for your next period to be different than usual. It might be heavier, lighter, or come at a different time than expected. Most women can return to normal activities within a day or two, but you should avoid putting anything in your vagina for about 2 weeks to reduce the risk of infection. It's common to experience a range of emotions after an abortion. Some women feel relief, others might feel sadness or regret, and many experience a mixture of feelings. All of these reactions are normal. If you're struggling emotionally, don't hesitate to reach out to a counselor or support group. Frequently asked questions about medication abortion. Number 1. How long does a medication abortion take? The process of medication abortion takes a few hours after you take the second pill, misoprostol. The heaviest bleeding and cramping usually occur within 4 to 6 hours of taking misoprostol, but light bleeding may continue for up to 2 weeks. The overall process, including follow-up, typically spans about 1 to 2 weeks. Number 2. How painful is a medication abortion? The pain varies from person to person, but most women describe the cramping as intense menstrual cramps. Over-the-counter pain relievers like ibuprofen can help manage the discomfort. Number 3. Is medication abortion reversible? No. Once mifepristone is taken, the process cannot be reversed. It's important to be certain about your decision before starting the medication abortion process. Number 4. When can I resume normal activities after a medication abortion? Most women feel well enough to resume normal activities within a day or two after the heaviest bleeding subsides. However, it's a good idea to avoid strenuous physical activity for at least a few days. Number 5. Will a medication abortion affect my future fertility? No, medication abortion does not affect your ability to get pregnant in the future. Your fertility returns quickly after the abortion, and you can become pregnant again almost immediately. It's important to start using birth control right away if you do not wish to become pregnant again soon after the abortion. Number 6. What happens if the abortion is incomplete? If the abortion is incomplete, meaning that not all of the pregnancy tissue has been expelled, your healthcare provider may recommend a second dose of misoprostol or a minor surgical procedure, such as a suction or aspiration procedure. To complete the abortion, however, this is still rare. Now, we want to hear from you. Have you or someone you know gone through a medication abortion? What was your experience, and do you have any advice or tips for others considering it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.